So now that we talked about the genetic testing in AML, let's talk about what therapy options there are for new and relapsed AML. First up is Venetoclax. This is a very exciting new medication that was approved in 2020 for AML. And BCL2 is a target of Venetoclax. This is active in almost all AML, regardless of the mutation status. And this small molecule, which is probably about 100 to 1,000 times smaller than the COVID virus, goes into the cancer cell and blocks the protein called BCL2. And when that happens, instead of the cancer cells growing and growing, they do their normal routine, what it's supposed to do, and they die. So in this big study called VIAL-A, patients who were deemed to not be able to undergo intensive chemotherapy were split into two groups. One group got a medication called azacitidine and a sugar pill, a placebo. The other group got azacitidine plus Venetoclax, which is targeted therapy for BCL2. And this is what we called a survival curve. This is the proportion of patients who are alive at this particular months. And the top one is better because that means that more people are surviving, more people are alive. So the top curve is azacitidine plus Venetoclax, whereas the bottom curve is the patients who got the sugar pill. And you can see that there was about 5 months improvement in survival when we added the Venetoclax to the azacitidine. This led to the approval of this combination, azacitidine and Venetoclax, in newly diagnosed AML patients. Another medication called Midostaurin is a target. It targets a protein called FLT3. And there are two types of FLT3 mutations, ITD and TKD, and this Midostaurin targets both. This mutation occurs in about 25 to 30% of all AML patients, so it's a very attractive option. This medication was studied in combination with intensive chemotherapy, our usual, which is called 7+3. Anyone who had the FLT3 mutation and had newly diagnosed AML who hasn't had any treatment yet were then split up to two groups. One group got the chemo plus placebo, a sugar pill. The other group got chemo plus midostaurin. And just like the other curve, as we saw, the top curve is a better one. There are more patients surviving. So the midostaurin improved the median overall survival, so the length of survival, by about astonishing 50 months. So this again was approved by the FDA, and I believe in 2018. And this is FLT3 mutation is a routine test we send for everyone with newly diagnosed AML so that we can add on this medication if someone possesses this mutation.